Okay, all right, so this is a presentation that I put together on thyroid storm, which is basically a life-threatening hypothyroidism. And it's usually preceded by an acute event such as surgery, trauma, infection, and this triggers an increase in catecholamines, which then results in an increase in thyroid hormones. And this is usually in a patient with pre-existing hyperthyroid disease like Graves' disease or toxic multinodular goiter. All right. So this is just an image of the thyroid. So over here you have a normal thyroid gland. Now the black right there is areas where there's lots of dye being uptaken by the thyroid, and that indicates areas of active thyroid hormone production. All right. So black means hyperfunctioning thyroid hormone. All right. So right here you have Graves' disease, you have a diffuse uptake of the dye. That's because all that thyroid gland is producing lots of thyroid hormone, okay? Then over here you have a toxic multinodular goiter, and you have kind of multiple areas here of active thyroid hormone production. That's why those areas are very black. And this is a toxic adenoma, right? And that's just kind of one area of black, because all that black is where it's producing lots of thyroid hormone. So thyroid storm precipitating factors. You can have an abrupt discontinuation of anti-thyroid hormone medication, thyroid surgery, TIA, infections, diabetic ketoacidosis, pregnancy, iron contrast media, and what that is the contrast contrast media will feed the thyroid and make it produce more hormones. Also, you can have burns and amiodarone, which is about 50% iodine by weight, and thyroid hormone actually uses iodine as one of its building blocks. So this is a little point scale that I have for thyroid hormone diagnosis. Now, if you can see down here, right, so a score of greater than 45 is thyroid storm, and then a score of 25 to 45 is an impending storm. Now that's very, very interesting. So look right here. If you've got a temperature of greater than 104, that's a score of 30, which means there's an impending storm coming. And then look right here. If your heart rate is above 140, again, that could also mean an impending storm. And then finally, if you've got a person with a seizure or coma, that's also a score of 30, and that could also mean an impending storm. So if you see someone and their temperature is above 104, their heart rate is maybe over 140, and they've got a seizure or coma, you might want to keep thyroid storm in the back of your mind as a possible diagnosis. So some thyroid storm clinical features. You're going to have a fever of about 106, delirium, tachycardia. You can even have atrial fibrillation, warm skin, tremor, hyperglycemia from the increase in catecholamines and high thyroid hormone, hypercalcemia, GI symptoms, nausea, vomiting, diarrhea, abdominal pain. This is a little image that I found of symptoms of thyroid storm. So you're gonna have high fever, agitation, delirium, congestive heart failure, loss of consciousness. All right, so this is a little table that I have here on the thyroid toxicosis and thyroid storm. So thyroid toxicosis just means an increase of thyroid hormones in the bloodstream, and this is commonly due to Graves' disease. Thyroid storm is an increase in thyroid hormones plus multi-organ dysfunction. And as I said before, this is due to an acute event, like an infection, surgery, discontinuation of anti-thyroid hormone medication. So these are just some features of thyroid toxicosis, as you can see here. You're going to have the exophthalmos. Exophthalmos, early wrinkles, swelling of the face, enlargement of the thyroid gland. Right. Okay, so you have high output cardiac failure. and high output cardiac failure. So, in the so thyroid hormone causes an increase in metabolic demand in the tissues, and this has a direct vasodilator effect on the endothelium, which results in a reduced systemic vascular resistance. So the decrease in systemic vascular resistance is the primary disturbance, right? Now, in response to this reduced vascular resistance, there's an increase in heart contractility and heart rate, all right? So as a result, you're going to have an increase in pulse pressure and an increase in systemic blood pressure, okay? And this is why it's called high output cardiac failure, because however, what's interesting is that usually in cardiac failure, the hallmark usually is a decrease in cardiac output. However, in this case, you have an increase in cardiac output, and that's the hallmark. So this is just a little photo of high output cardiac failure symptoms. You know, you're going to have signs and symptoms of heart failure, you know, cardiac output of greater than 8 liters per minute, cardiac index of greater than 4 liters per minute. And this is a little diagram. As I said before, the primary disturbance is a decrease in systemic vascular resistance. And as a result, you're going to have a compensating increase in cardiac output. And that is why it's called high output cardiac failure, which again is kind of interesting because usually the hallmark of cardiac failure is a decrease in cardiac output. Okay. And so, all right, so you're also going to have the high oxygen there's also going to be a high oxygen content because the hyperdynamic circulation gives less time for the tissues to extract oxygen. And there's also going to be high output cardiac failure, which leads to a backup of pressures from the left ventricle, which results in an increase in pulmonary capillary wedge pressure. All right, so thyroid storm diagnoses. The diagnosis is an increase in free T4 and T3 with low TSH. The TSH is low due to negative feedback from the T4 and T3. And then also an EKG could also show atrial fibrillation, tachycardia. All right, so treatment are the 4 Ps, propranolol, which is a non-specific beta blocker, and this improves symptoms. PTU, which is an anti-thyroid hormone medication. Then you also have prednisone, which reduces inflammation if Graves' disease is present, and then potassium iodine, which decreases thyroid hormone via the Wolff-Chaikoff effect. Now, all these medications block the peripheral conversion of T4 to T3. And then also you're going to want to have cooling blankets for the high temperature as well. All right, and these are my references right here. And that is it.